Hello, my name is Ho-Won Kim. I am a PhD student who is working in the NIMBY lab at Ohio University. Today, I will share the recently published paper titled The Relationship Between Drop Vertical Jump, Axial Observation Brain Activity, and Kinesiophobia After ACL Reconstruction. As we all know, as an ACL nerd, individuals with the history of ACL injury have different brain activity patterns compared with the healthy controls when they're performing simple lower extremity movements. However, due to the technical limitation, it was hard to measure the brain activity that is related with more injury-relevant movement. So in this study, we use axial observation and motor imagery technique to induce the brain activity that is relevant with the injury risk movement. People also suffer from the psychological alternation after ACL injury, such as a kinesiophobia. This is the most common factor that prevents athletes from returning to activity. And also higher fear is associated with the poor functional outcome and secondary ACL injury risk. So in this study, we want to see, is there any relationship between kinesiophobia and brain activity in ACLR group? Axial observation and motor imagery techniques are based on the mirror neuronal system. Simply, some brain area is activating similarly when you're actually performing compared with when you're imagining or observing the movement. We had 26 total participants, and ACLR group indicate higher fear compared to healthy controls, even though they're all clear and returning to their previous activity. Participants were asked to imagine themselves as a person in the video, and they're actually performing this movement without any movement. We found ACLR group had lower brain activity in right ventrolateral prefrontal cortex, which is a brain area plays a role in reorienting attention. So this result might indicate brain mechanism for decreased ability of the dual task after ACL injury. We also found positive relationship between kinesiophobia and brain activity in amygdala, mid-temporal gyrus, and cerebellum. This area is related with the fearful event, and this result indicate that ACLR group with the higher fear consider drop vertical jump as a fearful movement. So what we found was ACL group has a different neuronal strategy, and also kinesiophobia further alter brain activity in this group. So as a clinician, we might need a new rehabilitation strategy to prevent or restore the altered brain activity, and we also need to manage the psychological factor to improve the patient outcome after ACL injury. I want to say thank you for all my collaborators and Matt Botman for providing this opportunity to share my paper with you guys at ACL Study Day. If you guys have any questions, please let me know. Thank you so much for my lab members and my lovely wife. Thank you.